welcome to the Discourse KE. My name is Emmanuel Mamadi. This is a platform where the youth come to discuss topical issues that affect them in their country. And today, I'm here at Ukombozi Library. Today's topic is Covid-19 and the state of the nation. And with me today is Isaboke Neville, who is a political analyst, and Amon, Kemei, a postgraduate student of Armed Conflict and Peace Studies from the University of Nairobi. COVID-19 has been there, people have grappled with it, and today we are going to discuss the state of the nation in Kenya. So the Kenya COVID-19 statistics has surpassed the 9,000 mark by 10th of July. So, and the death rate as of 10th of July, there's a medical doctor that died. That is Dr. Doreen Adisa Lugaliki, who was announced dead by the Health Cabinet Secretary, Mutai Kagwe, as a result of COVID-19. So this raises questions. Are our health practitioners really safe? Do they have the equipment that is required? So today we're going to delve much into it. So by Friday, 10th of July, Kenya had tested 206,584 and there were 181 deaths and 2,733 recoveries. So to my guest, welcome.
Thank you.
Yeah, so there's been concerns from the public surrounding about the numbers, about the statistics about this, the COVID-19 that have been issued to the government. So what do you think about this number? Are these numbers real?
From my side, I can say these are real numbers, although a lot of people question whether these numbers exist,
yes,
or they are just being cooked by the Ministry of Health,
yes,
so that maybe they can, for other results, which are some of the, which include maybe for a country to receive some funding.
yes.
But according to my opinion, is that these numbers are real.
Yes.
Corona is real in our country.
Okay. Yeah. Okay. And just to you, Neville, there's been concern and also myths surrounding the existence of the COVID-19. Actually, there are people somewhere that they believe there's no COVID, there's no coronavirus in Kenya. What do you think?
I think such people should now start believing that Corona is here with us, and we have seen a fatality yesterday where we lost a doctor.
Yes.
And if there are really people who follow news, especially international news, we have seen countries, especially in Europe and the Americas, where we have lost quite a huge number of people.
Yes.
Right? So it's not something that we should. This is not one of those tales by moonlight which we are used to in Kenya from the government.
Yes.
So Corona is here with us, and we should take all the precautions that the government is telling us.
And do these statistics resonate with what's on the ground?
On the statistic part is now where we have the bone of contention.
Yes.
Kenya being a country which is well known for cooking numbers, especially during electioneering periods, I think is where the people have not.
This is about health. This is not electioneering.
Yeah, you know, be it health, be it politics, everything in Kenya is looked from the lens of a political perspective, right?
Yes. Yes.
So even if it's health, like you have said that some people are not even believing that coronavirus exists simply because politicians have told them so,
Yes.
right? So these numbers have not really, the government has not really done much to inspire the confidence to Kenyans, especially with the numbers. I think it's because of how the government has been dealing with past problems that we have been facing as a country.
Okay.
Yeah.
So back to you, Neville. On the 6th of July, we saw that the president announced and lifted the cessation and also the lockdown in the country in order for the economy at least to open up.
Yeah.
So was this a wise move for the president?
I wouldn't say it was quite a wise move, but the president was left with no options, right? Because we have seen that the coronavirus pandemic has really taken a toll on the economy. Various people have been laid off, especially in the private sector. Many people have lost their jobs, and most people are just merely surviving in Nairobi, right? So suspending the secession movement from in and out of Nairobi metropolitan area, Mombasa County, and Mandera was really to be able to help some of these people move maybe to the countryside where life is a bit cheaper. And various guidelines were put forward to be able to reduce the spread of the disease.
So why would you not consent to this being a wise move? yesterday saying that it will help people to move from one place to another. This is opening the economy.
It wouldn't be wise because if you look at the behavior of Kenyans, even when we were on lockdown, right? We had people having parties. We had people having this don't care attitude, like you said during the start of the interview, that some people don't even believe that
the corona existed.
Right? So I think he was just he was in a dilemma sort of, and he chose to just open it. And he said that he might even put those areas on lockdown if the cases are.
So you're a bit hesitant with it because you fear that it might exacerbate the effects of coronavirus.
It might. I think it's a question of wait and see. If people are not responsible enough to follow the guidelines being given by the Ministry of Health, I think we are going to see a spiral in the number of cases that we are
experiencing. So the numbers will highly spike.
They might. They probably
they'll spike.
The number will increase because people in Nairobi and other counties that particularly Mandera and Mombasa will transfer to other counties, particularly in their country. People will suffer a lot. Many will report a lot of deaths in the upcountry, in our home counties. So it was, particularly on my side, this was not a wise move by the president.
Okay.
But maybe he wanted to save the economy from collapsing.
Yes.
I think that was the major motive for the president to open the.
Do you think it is effective? Will it be effective?
Saving the economy, we have been having a lot of. Kenya received a lot of funding. Yes. We think we need to cushion the economy from.
Just hold that thought about funding. Okay. So among the restrictions that have been put in place, we've seen that churches have been given a leeway where they can reopen, but though there are some restriction to it. So some will claim that this is a double standard, opening the churches, because churches are gathering and other ventures have not been opened. What do you think about this?
We know that the bars and restaurants have been operating, and opening the churches will also, the numbers will keep rising.
Yes.
In the country, because controlling all the churches in the country will be a tall order for the government, and we are expecting cases of coronavirus to rise because of Kenyans. We know normally do not take cautions or precautions from the government seriously.
In your own opinion, should the churches have been closed?
To remain closed.
To remain closed.
Yeah.
What about you, Neville?
Yeah, I think I wouldn't even call what we have in Kenya churches. I would refer to them as social clubs. So the president could have just left those social clubs closed because they have done little.
But they've registered as churches, not social clubs, as you put it.
Yeah, they're registered as churches, but what they're doing are not what a church that is really following the teachings of our Supreme Lord Jesus Christ will teach, right? Before coronavirus, we had all these sorts of preachers doing lying wonders, like a preacher can just do like this, and the people fall under the anointing and they are healed. So what happened? Coronavirus sent all of them indoors, right? So I think the church should remain, not even the church, those social clubs should remain indoors until such time when the scientists find a vaccine. So that.
Are you a religious person yourself?
Yeah, I can say I'm a spiritual person.
You can say a spiritual person. Do you think opening of churches has affected you in any way?
It has not affected me because I've still been attending church online. I've been getting the message, which I call the Eucharist. But these social clubs, what these businessmen are doing, parading as pastors, is just they want the churches to open because some of them have even admitted that their business has really gone down. So it's all about the money,
Okay, that's a discussion for another day about religion. So coming back to you announced about the donor funding and everything. You can see that Kenya has received numerous donations from the pandemic. From April 2nd, 2020, so that 50 million was disbursed by the World Bank, 100 million from the Hindu Council of Kenya. As of 27th of June, we can say that Kenya has received 700 million from the US, 35 billion from the EU, 100 billion from the World Bank, 300 million from Equity, and 50 million from KCB. And also there, I think it goes to a tune of billions. Also so the Central Bank of Kenya had issued. And other supplies also. You saw philanthropies like Jack Ma issuing testing kits and everything. So you can see, do you think these funds have been effective in trying to cushion the economy in these pandemic times?
these funds that have been disbursed by these organizations and individuals, they are being misused by our government.
Yes.
Because people continue to suffer, people are losing jobs. We don't see any government interventions. People are buying masks, they are buying sanitizers. We don't see anything that the government is doing to cushion the economy from collapsing. And I think we live in a country where corruption is endemic. And even the funds meant for COVID-19, you wonder, where do people get that energy? Where do humanity go? Where people just squander the money which were meant for helping the poor, helping cushion the economy so that the poor cannot suffer. According to me, because we saw some few weeks ago, we saw the Ministry of Health
And release all their funding
Yes.
expenditure.
4 million on teas and snacks, airtime. Surely that.
But the cabinet secretary came out and defended and said that the health workers have to eat.
4 million, eating 4 million, that is very pathetic. Pains. People suffer in this country.
Okay, what about you, Neville? What do you think about that? Have these funds been used effectively? And also, just to add on to it, I saw a report that saying that some of the bourgeoisie people, they're trying to install ICU beds in their homes. Do you think this is the right move?
I think they are now coming to terms that death is really knocking on their doors, and all the monies that they have at this time cannot save them, right? Because if somebody installs ICU is like the last resort. So I think they are preparing for the worst because they are seeing that coronavirus is really something that is not it's not child's play,
Okay.
right? So I think it's not something that is not anything that anybody will wish for himself or for anybody. But those who are anticipating death, I think they have reached a point in their lives where they are really, like, I don't know, they're really making amends with their lives.
Okay. What about the expenditure of the funds that have been issued,
Okay.
especially in the county governments?
Okay. I think as a country we have serious accountability issues, both in the national and the county governments. We have not come to that point as a country whereby citizens have complete confidence on the accounting systems we have as a country, right? That is where all these monies which we have here, we don't know where they went to, because as my fellow panelists have said here, right? People are not feeling the effect of the money, right? The money was meant to cushion the vulnerable in society, right? But you see that the vulnerable, if you look at the dailies, the vulnerable are still complaining that they are maybe going without food, right? Some of them can't afford the basic necessities. So the government, according to me, has not really done much to use the monies that they have received from donors to help the vulnerable in society.
Okay, now getting back to the protection and also in terms of our health workers. So how safe are our health workers, considering that the death of one of the doctors, Dr. Doreen Elisa, how safe are they, because she succumbed to COVID-19? How safe are our workers?
Our workers really have so far done a very commendable job, and I think the death of the doctor yesterday is really an eye-opener to the plea of health workers, right? The health workers have for months now been pleading with the government to provide for them protective equipment, the PPEs, the N95 masks that are top-notch, that because they are handling patients and this pandemic, which we don't have a solution to yet, it's not something that we should be treated with, it should not be something which should be taken lightly. So our health workers have not really been given the support that they need to fully combat this disease, like as compared to other countries like in Europe or America, right? Yeah. So this money that the government was given, it was supposed to chip in some of this protective gear that the medical personnel are supposed to wear. But as usual, the song still continues. The money has probably ended up in a few people's pockets, and maybe they'll be using it to campaign for the next electioneering period.
Okay, back to economy, Amon. So you've seen a recession in terms of the economy. We saw a report that 300,000 people are rendered jobless and also unemployed, and also some people are laid off, so many people at this time, and also small businesses have closed down because of the COVID-19. So, what do you think? What is the best solution to this? Especially, how can the government take step?
I think the best solution that the government can take at the moment is that it needs to use the funds that the grants that have been donated by individuals and other organizations, so that we can maybe engage in activities, manufacturing activities that can boost the economy. Because one of the big four agenda of the president was to ensure that we have a manufacturing sector being improved. That is the way to go. We invest in manufacturing so that it can create more jobs. Because in our country, unemployment has been so high, and because of Corona arriving in our country, it has even worsened the situation of employment.
I saw a report that 4 million people have been unemployed.
So that is a threat to even the peace in the country, stability in the country, and I think the best solution is for government to focus to invest in infrastructure or invest in activities that can lead to employment. Maybe, particularly, my opinion is that the government needs to invest in the manufacturing sector, so that can invest in agriculture, invest in manufacturing sector, and that is it will create a lot of jobs instead of doing a lot of things which cannot create employment, such as the activities such as SGR, which are particularly.
Okay. So how well can the economy be cushioned? But also, how well can the government come in? Is there something government can do more in order to try and cushion?
I think what the government can do at this point is to salvage the little resources that I know that they have, to be able to project these resources to the sectors that have been really hit hard by the pandemic. We have seen, for instance, the tourism sector, right, which approximately 1.3 people have lost jobs directly from the tourism sector, right? So the government needs to give incentives to these players, the stakeholders in the tourism sector, for instance. And also, apart from tourism, another very vulnerable group that we are forgetting are those teachers, for instance, who are not employed by the Teacher Service Commission, right? Those who are employed by the private schools, right?
Yes.
These are people who have families. They are people who, before the pandemic, had their lives going on, right? But since the Minister of Education announced that the schools will be closed for the better part for the rest of the year, right? It's like the academic calendar has been suspended. They are the type of people who are supposed to be included in the group that are the vulnerable, right? So if they cushion such people against the pandemic, right, I think they'll be able to be helped, and they'll be able to at least get their lives going, and they will not really fall by the wayside.
Okay, my panelists, am I right, Amon? Thank you so much.
Thank you.
Isaboke.
Thank you.
It's been a pleasure having you guys here. Now, it's good to remember a country is treated on how it treats its people, and not only the rich people in terms of crisis. Thank you. My name is Mamadi.